Hi, I'm Dr. Matthew Bose, and welcome to our video series. Proper therapy exercises are important for recovery from most orthopedic conditions. I've designed this series to provide you with up-to-date therapy regimens that you can access at home, in the gym, or on the road. I hope you find these videos helpful, and best of luck in your recovery. Keep your knee well functioning. We want to make sure the muscles around it are nice and stretched out. Remember to hold the stretch where you feel it for about 30 seconds. Lean into the stretch till you feel it in the back of your knee. The knee can only function properly if the muscles around it are nice and stretched out. Again, stationary bike or other types of cross training are good for strengthening as well as keeping up your cardiovascular endurance, and we want this to be part of your regular routine after surgery indefinitely. If you have access to the gym, you can start doing some light strengthening on the leg press machine. Alternatively, if you don't have access to the gym, or if this is more comfortable, you can do light dumbbell squats. This is to strengthen muscles in your hip and your back. Hold a cane, or you can hold some light weights. We don't want to put too much strain on your back, so only bend as forward as is comfortable. And if you're feeling strain in the back of your legs, bend your knees slightly, but we want you to lean forward and try and touch your hands down to the floor in a progressive way. Continuing with hip exercises, you can add ankle weights, bringing your leg across your body into adduction and then out to the side into abduction. Helps strengthening the muscles around the hip. Hold the final position for a second or two to give yourself more strengthening. And the same thing in terms of strengthening, progressing with no weight and then light ankle weights as your strength increases. Done with flexion of the hip and then back into extension. Coming up on your toes, this will strengthen your calf muscles. If you want to increase the resistance, you can add some light dumbbells. It's important to strengthen your core. These are some very light abdominal exercises that'll really help you functionally after the surgery. Lift your shoulder blades and your heels off the floor. Try and get your fingertips moving towards your toes and hold that position for a few seconds at the top. And we have you start doing some light functional exercises at this point. This is a good time to start swinging the golf club just in the air, as well as the tennis racket, just to get the muscles moving again and getting your body starting to get used to these types of activities. Full clearance for these activities come only with the approval of your doctor as he continues to follow you along.